oocyst that's very, very hardy, and so for that reason, it can survive even in the presence of chlorine in our water. Okay, so it can be hard to kill. Hepatitis. So hepatitis is inflammation of the liver, and in this case, it's going to be due to a viral infection. Okay? There are 3 viruses: Hep A, Hep B, and Hep C. Hep A is self-limiting, goes away on its own, and is transmitted through the fecal-oral route. Hep B is transmitted through contaminated bodily fluids, so sex, birth, or dirty needles. Most of the time, it's not going to cause a chronic illness, but occasionally it will cause a chronic illness which can stay with you for the rest of your life, resulting in cirrhosis or scarring of the liver. And then hepatitis C is transmitted through blood only, and this results in a silent disease that usually takes 10, 20, 30, 40 years before it slowly starts to change your liver into cancer. All right, so then on to the helminth diseases. Now for the helminths, I know there's a lot of them. They all have weird names, so I don't expect you to know every single one of them. Okay? For the helminth diseases, what I want you to take from it are the generalized information on how helminth diseases infect the GI tract, which we're going to talk about in a second. But also, you can pick your one favorite organism and know a little bit about it. Okay? A little bit about what it infects, a little bit about its life cycle. Because if I were to ask you a question on it about the exam, or on the exam, it would be describe one helminth and how it causes disease. Okay, something very general like that. Now, in general, helminths have evolved with humans over long periods of time. So for this reason, they are very good at infecting us without giving many symptoms. So one of the telltale signs of having a helminth infection is very little symptoms at all. Okay? And that's primarily because these organisms have very specialized virulence factors, like serrated mouth parts, cuticles, enzymes, and things, which protect it and help it infect humans without causing much irritation. However, occasionally your immune system will respond to this, and it's your immune system's response to the organism that causes the damage, not the organism itself. And then remember, the definitive host is the organism in which the parasite likes to grow and reproduce in. We diagnose helminth infections primarily by looking at feces. And that's because most of these organisms are going to release eggs in the feces. We can also use serology, or looking at antibodies, to determine whether or not a patient has been infected. As far as treatment and prevention, there are 5 readily available drugs, and there's so few of them because these guys are large, multicellular eukaryotes, which evolve very, very slowly. So for this reason, they have not developed resistance to most of these. But keep in mind, these often only work on very specific portions of the organism's life cycle, and if it happens to be only on the larval stage, then you will have to take these for long periods of time until the adults die of natural causes. All right, so then the rest of these are just, all the different organisms. Like I said, pick your favorite and know a little bit more about it. Okay, for the exam. All right, that's it for that guy. On to chapter 23, genitourinary system. So the urinary system is found in both males and females. Infections in here called UTIs, or urinary tract infections. And then for the reproductive system, you have both the male and female reproductive system that can be infected. And these are often called sexually transmitted infections. They're STIs. So UTIs and STIs. As far as the urinary tract system, the biggest defense here is the flushing action of urine. Okay, so every time that you urinate, you're flushing out the organism that may be present there. As far as the male reproductive tract, the biggest defense is flushing action of urine. So every time you urinate, again, you're pushing the organisms out. For females, the biggest defense is actually the commensals found within the vagina. So the bacteria, which are primarily lactobacilli, these create a relatively caustic environment, making it hard for most organisms to grow and then cause disease. And so as far as normal biota are concerned, in both the urinary tract system and in the male genitalia, there really shouldn't be much. You may see some in the urethra, but other than that, it should be relatively sterile. In the female reproductive tract, you're going to see a lot of organisms in the vagina. And again, this is normal. It is healthy to have these organisms. Without them, you are more susceptible to getting vaginal infections. So UTIs are urinary tract infections. This is an infection with an organism in any part of the urinary tract. However, the most common is going to be cystitis or inflammation of the liver. And remember, most of the time these organisms are going to be commensals from your gut that have gotten into the wrong place. Okay? Now, if you don't get it treated in the gut, or excuse me, in the bladder, it can work its way up into the kidneys, causing pleonephritis, which can be a much, much more serious issue. Okay? But generally speaking, UTIs are on the milder side and relatively easy to treat. All right, on to the sexually transmitted infections. Remember, we call these sexually transmitted infections, not so much diseases anymore, because most of these are asymptomatic. So make sure you understand why they are often asymptomatic. Remember, it's beneficial to be asymptomatic in the repo tract because chances are you're not going to sleep with someone that's got pus oozing out of their penis or vagina, right? Also, if it's painful down there, they probably don't want to have sex, unless they're weird. Now, we break these up into 3 categories: discharge diseases, ulcer diseases, and wart diseases. Okay? So for, and before we get into those, let's talk about some of the diseases that affect females and males, okay, separately. So for females, it's primarily infections of the vagina. The 2 groups of these are going to be vaginitis and vaginosis. The biggest difference between the 2 is vaginitis has inflammation, vaginosis does not. Okay? Vaginitis is often caused by Candida albicans or yeast. Vaginosis is often caused by bacteria. Okay? In males, you can also get an infection within the prostate, which is, again, something we don't see in females because they lack a prostate. This can result in prostatitis, okay, or inflammation of the prostate. Biggest problem with this infection is that it swells the prostate, making it difficult to urinate or ejaculate. Okay? But again, not that big of a deal, at least in unusual context. All right, so now into the discharge diseases. In the discharge diseases, there's 2 guys that we talked about: gonorrhea and chlamydia. And both of them are fairly similar. Okay? So what I want you guys to be able to do for the exam is understand the differences between them. Okay? So both gonorrhea and chlamydia cause discharge, right? You know that. Gonorrhea is a gram-negative diplococci, which you can easily see with a gram stain. Where chlamydia is a very, very small, kind of weird bacteria, which you cannot see with a light microscope. So one of the big differences between the 2 is that gonorrhea, large, gram-negative organism, chlamydia not. Why is this important? Because you can diagnose a patient just by gram staining their discharge. Okay? Now, both of these cause discharges to be released in both males and females. Okay? In males, it's going to be in the urethra. In females, it's going to be the urethra and or the vagina. Okay? Now, in gonorrhea, the discharge is often white or yellow in color, where chlamydia is often clear. Okay? Also keep in mind that gonorrhea tends to cause more symptoms than chlamydia. Chlamydia is often asymptomatic. And this is true for both gonorrhea and chlamydia. Females tend to be more asymptomatic than males. Okay? This is a trend you'll see again and again in repro diseases. Now, the biggest problems with gonorrhea and chlamydia is going to be sterility in both males and females. Okay? But in females, it can also cause more problems, like scarring and ectopic pregnancies, as well as infecting their newborn child, causing neonatal conjunctivitis. Okay? And again, this is true for both gonorrhea and chlamydia. Both of these are relatively easy to treat with antibiotics, and both of these, well, chlamydia in particular, are very, very common, okay, in the population. Ulcer diseases. Okay, so ulcer diseases are where you have an organism that infects the skin, causing an open sore. Okay? Not only are these problematic because they're gross and they hurt, but they also open you up to getting other infectious diseases, okay, like HIV in particular. So the first big one is syphilis. So syphilis is caused by a spirochete known as Treponema pallidum. Remember, it has 3 distinct clinical stages: primary, secondary, and tertiary. Primary is where the organism gets through unbroken skin and causes a hard, rubbery ulcer that is painless. After a couple weeks, this spontaneously goes away. However, the organism is still there. It has just worked its way into the lymphatic system and into the bloodstream. This causes secondary syphilis. Secondary syphilis is marked by having a flu-like symptoms, as well as a red, blotchy rash all over the trunk of the body. After a couple weeks, this then goes away. However, the organism has now worked its way into hard-to-reach areas like the brain, the liver, the kidneys, and other organ systems. And at this stage, it then kind of dies down and goes into a latency period, which can last for decades. And then randomly, it starts to wake back up and grow again. Your immune system then responds, and you develop tertiary syphilis, which causes neurological problems and open oozing sores on cartilaginous tissue. At this stage, it is often life-threatening. Remember, it is only treatable and transmissible during the primary and secondary stages. Okay? Latency and tertiary tend to not be transmissible or treatable. The other guy in this group is herpes, and herpes is caused by a virus known as HSV-1 or HSV-2. HSV-1 targets the oral region, HSV-2 targets the genitals, but remember they can flip-flop. Now 70% of us are infected with this. Most of us do not develop symptoms. However, some of us will, and that's because it can infect the nerves in the peripheral system, lie dormant in them or go latent, and then randomly later on kind of wake back up and cause these superficial ulcers to form. Now they're superficial because they're just in the epidermal layer, which means they do not scar, but they still can be painful and uncomfortable to have. Generally speaking though, it's not that big of a deal. It goes away on its own. However, you will be infected for the rest of your life. Okay? You can treat with the cyclovir in serious cases. Also keep in mind that it can infect newborns if you get infected with herpes for the very first time while pregnant, or deliver a baby through the vagina with a severe herpes outbreak. Okay? And this often is very life-threatening for the child. It causes encephalitis and usually death. This will be on the exam, by the way, so make sure you understand how to use this. Last but not least, wart diseases. And the big wart disease is HPV, or human papillomavirus. Okay? HPV is a relatively common infection, right? It's a virus that has over 100 different types, most of which do absolutely nothing. Okay? Some of them, however, can cause benign skin growths, which are called warts. Okay? They're benign because they're not cancerous. They're relatively harmless to have. However, if you have a lot of these, they can be disfiguring and kind of uncomfortable. They can be removed using immune stimuli, which tends to work relatively well. Now, there are even fewer serotypes or flavors of HPV that can also cause cancer, primarily 16 and 18. And these can only cause cancer at very particular junctions of epithelial cells. So think cervix, anus, mouth, and the penis. Okay, those are the four most common places. Now, generally speaking, these are relatively slow-growing cancers, so they're pretty easy to spot and relatively easy to treat if you catch them early. Okay? The good news is that these are slowly declining thanks to the advent of the Gardasil vaccine, and this protects you from most of these, primarily 16 and 18, which cause about 90% of cervical cancer. And remember, this is sexually transmitted. It is very common to the point where if you've had sex with more than one individual, unprotected, chances are you've gotten HPV before. Okay? You just got to cross your fingers and hope it's not one of the bad guys. All right, that's it for 23. That should do us. Any questions on anything about this exam? Hopefully I whittled down the information a little bit. Okay? All righty, well, I will see you guys on Thursday.
Mark, can you send that